It was June 5th, and we were just outside working and came inside for lunch and sat down to eat, and all of a sudden he couldn't communicate. What he was saying wasn't making any sense, and so I knew right away there was something wrong. And so I said, "Get ready, we're going to the hospital." And we got there pretty quickly and went right into the emergency room to the desk and said, "I think my husband's having a stroke."
When I met Rob and Linda and saw the films from his CT angiogram of the neck and heard his story, it was very clear that something needed to be done, and he was a good candidate for surgery. Geisinger Medical Center has a long history of expertise in the placement of carotid stents. So it was a natural extension for our department to go into this new territory of placing stents via the small incision in the neck, or the transcervical carotid stent placement. And we are a major referral center for people who are better candidates for this technology rather than the standard open procedure.
Really, for two people that have been healthy our whole lives, we just don't have a lot of contact with medicine and hospitals and doctors' offices, and then all of a sudden we were thrown into all of that. And the whole experience was just so positive for us. Getting to meet the staff and their guidance that they gave us on what we needed to do next and where we needed to be was just so helpful and comforting, really, at a time when you're have a lot of anxiety about everything that's happening.
When people come to me in the situation that Rob experienced, their risk of having a stroke in the next 2 years is as high as 25%. Living under the specter of having a potentially life-altering stroke produces great anxiety for people. What we were able to do is reduce his risk of having a major stroke from that 25% range down to around 5 or 6%. So his surgery was a great success. He had no damage to any of those important nerves. He experienced no further stroke symptoms. What really stood out to me was after the operation, he was wide awake, talking as if he had had no procedure done at all.
I was standing by the recovery bed when he walked in and just walked right past me, and I figured, did he even see me? He turned around and he said, "I was looking for Mr. Brown." And I went, "Here," because I was standing up, just waiting for somebody to release me to see my daughters again. He just looked at me and he said to the nurse that was there, he said, "Do you believe this guy? He just had the surgery."
If you look at the gamut of vascular surgery, so many things are advancing and heading towards more minimally invasive approaches. And the transcervical carotid stenting technology has allowed us to treat some of these difficult carotid lesions with faster recovery times and equivalent outcomes to the previous gold standard, which was open carotid surgery.
This is to help other people know what's out there and to feel like they can take advantage of these marvels of medicine and have a good outcome too, and continue on with their lives.